Okay, this video is called Soteria. Soteria, like in Greek, means deliverance from harm or safety. And where this comes from is from the treatment of patients with schizophrenia and psychosis. This is a very important concept. We'll develop it here real quick. Schizophrenia means like split mind. Psychosis, these are psychotic patients. They're typically treated with antipsychotic medications. Antipsychotic medications are also called neuroleptics. They're notorious for having bad outcomes. And the chemical effects have been described by Peter Breggin, who is a Harvard-trained psychiatrist, as being very much like a chemical lobotomy, a chemical frontal lobotomy, a brain-disabling effect. Antipsychotic medications also have a significantly, relatively high incidence of tardive dyskinesia. They're blocking dopamine transmission. And what is Parkinson's disease? A disease that's deficient in dopamine, so they also will have motor symptoms. And these can be quite disabling socially. And this slowing down of muscular movements and discoordination of muscular movements can even progress to something called tardive dementia, with a slowing down of brain function and progressive impairment of brain function. Now, Loren Mosher here was perhaps the most famous psychiatrist in the entire United States, a very prominent researcher in the world of schizophrenia. And he had thought that some of these schizophrenic patients were previously, normal individuals who'd had like a mental breakdown, if you will, due to some stressful event in their life. And he thought maybe if they had some time to work through the emotional issues in their problem, the philosophic meaning of their life, get that figured out for themselves, they might be okay. So Mosher had the schizophrenic patients randomized to a residential living home, would be the treatment group of interest, and then the other group was just standard care by hospitalization, institutionalization, which typically involves a lot of medications, antipsychotic medications, to see how they would do. So what happened was 42% of the patients that went to Soteria, which is the name of the residential home for these patients, didn't need any medications at all. It ran for a little bit over 10 years altogether, and that was a Soteria house out in Santa Clara in California. There have been some imitation versions of that with a Soteria house in Vermont, and there have been some in other countries as well. So what happened? At 6 weeks, the Soteria patients had equal outcomes to institutionalized patients on antipsychotic medications. If you give a patient antipsychotic medications, very powerful medicines, the patient will be subdued more quickly. In case their behavior is quite difficult, that'll quickly get them under control, so-called chemical straitjacket metaphor. At 1 year, though, it wasn't even close. The Soteria patients were doing much better, and on long-term follow-up, much, much, much better. So that's good to know, because what you really care about is what's their long-term follow-up. How's this kid going to do? Parents will have a kid. The kid has a psychotic breakdown. They're hoping the kid will have a good long-term outcome. And the conclusion of the Soteria study was, yes, they do much better if you minimize the antipsychotic medications and you engage them with regular conversation, with respect, with love, and a safe environment so they can work through their problems, give them some time. The person staffing the Soteria house, most of them were non-professionals. A psychiatrist was aware of what's going on, but the idea was by maintaining social engagement and social relationships in a supportive social environment, that they would have time to work better. Okay, so on long-term follow-up, the Soteria patients had better cognitive function, they had a higher employment rate, and they lived longer. And these are all significant differences in how much better they did. They also had a higher marriage rate, which might make you question their level of cognitive function. Okay. Soteria means deliverance. And then here's a question about who gets better results. Because there's a lot of people who say, the modern world, we've got science and mankind. All we need is science. Yeah, right. Most of what the average person thinks is science is just advertising. Okay, so let's see. Who gets better results? If you got hyperlipidemia and coronary artery disease, you go to a cardiologist, you're going to get pills for life, and then maybe a coronary stent or open heart surgery. If you take Esselstyn's diet, low-fat vegan, 99.4%, no recurrent problems on a 4-year study. And he says the one patient who had a problem out of 198 didn't follow the diet. So that's interesting. So what did big science give? A lot of pills and procedures. Okay, what did just reading and getting educated give? Better results. Hypertension. You go to most doctors, pills for life. Go low fat, low sodium vegan. According to Nathan Pritikin and Dr. John McDougall, about 90% of patients don't need any pills if they can get their diet under control. And their lifestyle helps as well. Diabetes type 2. Go to an endocrinologist, pills and injections for life. Definition of a chronic disease is never cured. Zero cure, okay? Your only chance for cure, because it's a dietary disease, you can't cure a dietary disease with a pill. The only hope for a cure is to optimize the diet. What is that? Low fat, low sodium vegan. If started within 4 years of diagnosis, most are cured. That was the work Rob Taylor had written that. He's a PhD. He's an MD. He won the Banting Award. And he wrote a good book, too, about life without diabetes. Okay, schizophrenia. Go to a psychiatrist. If you go to a biological psychiatrist, that means your typical MD psychiatrist, it's almost guaranteed they're going to give you a medication. All right? There's different types of psychotherapy. That's a whole other topic. We'll talk about that some other time. And there's some pluses and minuses about that. According to Peter Bregan, MD, he's a Harvard-trained psychiatrist. He's written a ton of books. His nickname is the Conscience of Psychiatry. He says schizophrenics will typically be treated with a antipsychotic medication, which in his opinion is essentially the chemical equivalent almost of a frontal lobotomy. Okay, if you go to a place like Soteria, relatively high percentage are able to live in the regular world and work. So ideally, if the family was understanding and supportive and had the resources, somebody's home and understanding and able to handle the patient, maybe they would do better, but that would depend a lot on the family. Okay, for the sake of full disclosure, I can also tell you in my personal experience, 99% of persons will not follow dietary advice and will refuse to go low-fat vegan. Now, there's a difference between, most of the time I talk to people, they're just nice people who are fat. They're not specifically patients trying to recover from a disease. If the patient's highly motivated to recover from a disease, you probably could get a higher compliance rate than that. But on the other hand, the compliance rates that you'll see from someone like Esselstyn, I think, are unrealistic for the general population. Those are people who specifically sought out Dr. Caldwell Esselstyn rather than, just random, fat people. And my other feeling about it is, okay, fine. For 99% of people, they're going to be managed with pills anyways. But, for the 1% who are willing to be changed, they should at least be given that option. Most of the time, it's not even mentioned to the patient, or some nonsense like Mediterranean diet is talked about, which doesn't work. So here's a quote from the Bible, Genesis 18:22 and 32 to 33 verses. So chapter 18, Genesis. And Abraham said unto God, Oh, let not the Lord be angry, but would you also destroy the righteous with the wicked? Suppose there were 10 righteous people. Would you not spare the city? And God said, I will not destroy it for the sake of the 10. Let us ask God, for the sake of the 1% who would go vegan, can we at least offer them that option?